Okay, so in this video, I'm going to cover the butt muscles. Remember the iliotibial tract is down here this way on the outside of the leg. The gracilis is down here on the inside of the leg, and the sartorius starts up here and goes down and crosses the femur and ends up in the medial tibia shaft. So, but we're going to work on the muscles that are posterior on the back of you between the iliotibial tract and the gracilis. Let's turn this around here. So now we're looking at the posterior side of the skeleton. This is your back side. And the first thing I want to draw your attention to is the gluteus minimus. Now there's three gluteus muscles, gluteal muscles. There's the gluteus minimus, there's the gluteus medius, and there's the gluteus maximus. And in order, they go from small to large. So the gluteus minimus is the smallest, the maximus is the largest. And they also go from deep to superficial, from the inside next to the pelvic bone, and then on top of that is the gluteus medius, and then on top of that is the gluteus maximus. So they're kind of stacked on top of each other. So you're not going to see the gluteus minimus on most models. And I don't know if your teacher, you'll have to check with your syllabus because your teacher probably won't expect you to be able to identify this or know the origin and insertion points of this, but I'm going to go ahead and just tell you anyway, since we're doing all the gluteal muscles. So the gluteus minimus, it attaches right here on the posterior ilium, and this is called the gluteal surface of the ilium. Obviously, it's the gluteal surface because that's where all the gluteal muscles attach. And that's between the gluteal lines. If you remember in the bone review video in this muscles playlist, there's these little lines that come out on the ilium, on the pelvic bone there, and those are called gluteal lines. And so the gluteus minimus originates between those gluteal lines. And let me go down a couple layers so you can see those gluteal lines. So see, here is anterior gluteal line. Here is the inferior gluteal line. So right here, in between those two gluteal lines, the gluteus minimus attaches right there. And you can see it right here. This is the attachment area for the gluteus minimus. Now see, the gluteus minimus wraps all the way around to the front. There's its origin right here in the ilium, but then it wraps all the way around. Do you see this to the front? And here's also the gluteus minimus. And it attaches, it inserts right down here on the top of the femur. Now do you remember what the top feature of the femur is? That's called the greater trochanter. So it attaches at the greater trochanter, that's its insertion point. And this is the greater trochanter right here. And see how this comes up a little bit and it's rough? This is the lesser trochanter, this is the greater trochanter. And as you can see right here, this purple, that's the attachment for the gluteus minimus. And while we have it on that screen, you can see this is the attachment of the gluteus minimus right here. This is the origin point. So now we know the gluteus minimus, so obviously the gluteus medius is going to be in the middle, sandwiched in the middle between the gluteus minimus and the gluteus maximus. So let's turn this around to posterior view again. And let's add some layers onto that. And there we go, here's the gluteus medius. And the gluteus medius, you notice its striations are going up and down here. And the gluteus medius is attached on the posterior ilium. So here's this whole thing is the ilium, this bone, and or hip bone. And the gluteus medius is attached up here on the posterior ilium. And then the gluteus medius also wraps around to your side, to your anterior view, and it sits right on top of the gluteus minimus. See, there's the gluteus minimus that we just went over. Here's the gluteus medius. And the gluteus medius is inserted into the greater trochanter of the femur, and just like the gluteus minimus. So the gluteus minimus sits right in front, or is inserted into the femur right in front of the gluteus medius. And if we bring these layers down, we can see the attachment points. See, here would be the attachment for the gluteus minimus. And if we turn this around just a little bit, here's this line going across the greater trochanter is the attachments for the gluteus medius. So here's its origin point, and here's its insertion point for the medius. Now the gluteus maximus does not wrap around to the side like the gluteus minimus and the gluteus medius does. The gluteus maximus, you have to turn this all the way around to see the back of it. There we go. So this is the gluteus maximus. So this is the posterior view. So this is the most superficial muscle for your butt, the gluteus maximus. And as you can see, the gluteus maximus does not originate on the back of the ilium like the other two do. It goes all the way up to the iliac crest, and that's where it originates. It originates in the iliac crest, right up here. Gluteus maximus. See this? It originates right here at the posterior part of the iliac crest, and it also attaches to the sacrum, which this would be the sacrum, and the coccyx. Right here. So this whole thing would be the coccyx. And here's the sacrum. So it actually has 3 origin points just because it's so big and it's wide. So your gluteus maximus originates up in the iliac crest, and it goes down and originates in the sacrum, and it also is attached to the coccyx. And those are all the origination points. Now, where does it insert? It inserts in the iliotibial tract. You know, one of the 3 muscles that I showed you first, so you can use as a point of reference. The iliotibial tract runs right down your extreme lateral side, the middle of your lateral side. So your gluteus maximus, it not only does it originate in the iliac crest up here, and your sacrum and your coccyx, but it also has 2 insertion points. One insertion point is it comes down here to your side, and it merges with the iliotibial tract that goes all the way down to your tibia. The other section of it, see this side right here, would go into your iliotibial tract, would merge into your iliotibial tract right here. But then there's this other section, see it's shaped kind of like a butterfly, so there's this bottom section, and that goes into your gluteal tuberosity of your femur, which is why that tuberosity on your femur is named the gluteal tuberosity, because your gluteal muscle, your gluteus maximus, fits into it and inserts into it. And here's your attachment for the gluteus maximus. This is where it attaches. Here's another 3D picture of it. This is more of a far away shot Right up here on your greater trochanter, that's your attachment for the gluteus minimus, the minimal one, the one closest to your pelvis, the deepest one. If you turn this around a little bit, this line is the attachment for the gluteus medius. And down here in your gluteal tuberosity, let me get this turned all the way around. This line right here is your attachment for your gluteus maximus. See how far down your butt muscle comes down, and it attaches all the way down here. And see, this is called your gluteal tuberosity, and that's where your gluteus muscle is. Here's your linea aspera, where some other muscles that we've gone over attach. But this one, your gluteus maximus, attaches to your gluteal tuberosity. And then it also it merges into the iliotibial band, or iliotibial tract. This is the side view. And there's your iliotibial tract. Remember, it started up in the iliac crust, and it goes all the way down to your tibia. Well, this is why the tendon is so fat right here. The iliotibial tract tendon is so fat because, see, the gluteus maximus merges into this tendon that merges into the iliotibial tract. So that's its other insertion point. So iliotibial tract, and then under here it connects with the gluteal tuberosity. And underneath there is your gluteus medius, and underneath there is your gluteus minimus. So as you can see, this is a good lateral picture of your gluteal muscles. This is the lateral view of the gluteal region. And first, before we do anything else, I wanted to start off by pointing out a muscle that we overlooked that is kind of part of the iliotibial tract. Here's the iliotibial tract, this orange, and it goes down, and see, it originates up at the iliac crust, and it comes down like this. And it's called the iliotibial tract because it starts in the ilium and it ends in the tibia, and it goes down to the lateral condyle of the tibia. But right next to it, right in front of it anteriorly, is this little muscle right here. Now this is you would think that you have more muscles on the side of your hip to move your leg out and in. But this is it, just this little tiny band. This is called the Tensor Fasciae Latae. Here it is right here, Tensor Fasciae Latae. And it originates up here at the iliac crust, and it inserts, instead of inserting into a bone like the other muscles do, this just inserts into the iliotibial tract. It just merges into the iliotibial tract and becomes one with the iliotibial tract to go down and finally insert into the lateral condyle of the tibia. So this is your Tensor Fasciae Latae. I'll say it again. It sounds like you're getting a cup of coffee from Starbucks or something. But if you are standing here, let's say you're standing here and you're going to do exercises or you're going to do kickboxing or something. And here is the Tensor Fasciae Latae is right about there. And when this shortens, it pulls this whole leg up until it's parallel with the floor. So it pulls that whole leg up until your leg is raised up here parallel with the floor. So you would then be standing, and especially like if you do kickboxing or something, you would then be standing with your leg out, ready to do a roundhouse kick or whatever. All because of that tensor fasciae latae muscle right there. And so since this tensor fasciae latae muscle is moving the leg away from the midline, because this is the midline, right? So it's moving it away from the midline. That means it's an abductor. And I have flyers on abductors and adductors and flexors and extensors in my Google Drive. If you don't have access to it, please send me a message or leave a comment on my YouTube page, and I'd be more than happy to get you that link. Now, let's first go over the Gluteus Minimus, which you cannot see here because it is buried beneath these layers of Gluteus Maximus and Gluteus Medius. But the Gluteus Minimus attaches right about here in the posterior ilium. And it comes down and wraps around to the side. And it actually wraps around anteriorly, so it can insert at the anterior, on the anterior part of the greater trochanter. And that's of the femur. So it inserts right about here. And it originates up here on your posterior ilium, and that's the Gluteus Minimus. Now the Gluteus Medius starts right up here, right beneath the iliac crest. So it originates on the posterior ilium. And you see these striations, these go down this way. And it stops right where the Iliotibial Tract comes out. And this Gluteus Medius is medium size. It's a little bigger than the Gluteus Minimus. And that comes down, and that also wraps around to the side, just like the Gluteus Minimus, but it stops short of going anteriorly. Because what it does, and I'm coloring this in just to show you that it covers up the Gluteus Minimus. Because what this does, goes on the posterior greater trochanter. Of the femur. So let's say here's the greater trochanter of the femur right here. And so as you can see, the Gluteus Minimus attaches in the front and the Gluteus Medius attaches in the back of the trochanter. And I also want to point out that you can see the Gluteus Medius peeking out on the lateral side, on the superior lateral side. It peeks out from the Gluteus Maximus. So you should be able to identify this on a model or on a diagram without having to remove any of the top muscles or anything, because it peeks out and you can see this section of the Gluteus Medius up here. Okay, now for the Gluteus Maximus, the Gluteus Maximus is drawn great on here. It's this whole thing. It's the one that actually is shaped like a butt. And this comes down here too. And Notice the striations on this are going diagonally this way because it increases the strength if these three layers, the minimus, medius, and maximus, it increases their strength if their layers are all lying at different angles. So these striations all go in different directions from each other, and that increases the strength of all of them put together. So as you can see down here on the bottom part, this gluteus maximus turns into the iliotibial tract, and it goes on down with the iliotibial tract down to the anterior lateral condyle of the tibia. But it also inserts, because it has two insertion points, it also inserts right down here. It goes in the back. You remember how over here is the greater trochanter of the femur? Well, so that makes this the back of the femur, and this gluteus maximus attaches posteriorly to the back of the femur at what is known as the gluteal tuberosity. Gluteal tuberosity of the femur. Now, remember, tuberosity just means a rough patch on the bone where a muscle connects. So we named it the gluteal tuberosity because your gluteus maximus attaches there. So all three of these gluteal muscles attach to the femur, but as you can see, it goes from small to large, from inside to out, from deep to superficial, and also its insertion points are from anterior to posterior. So the gluteus minimus is the smallest muscle, and it's also the deepest muscle, and it's also insertion point is the most anterior, is the most in front. It inserts in front in the greater trochanter. The gluteus medius is the middle-sized muscle, and it's in the middle between the gluteus minimus and the gluteus maximus, and it inserts at the posterior greater trochanter. And then finally, the gluteus maximus is the biggest muscle, and it's also the muscle, the most superficial, the most outer muscle, and it inserts posteriorly on the femur to the gluteal tuberosity. Okay, now here is the posterior view of your lower skeleton. And we're going to draw this out to make sure that you understand where everything is. The gluteus minimus attaches in the posterior ilium right about here, and that's its origin point, and it comes down, wraps around the side, and attaches to the greater trochanter on the anterior. So it wraps around front. Wraps around the front of the greater trochanter. And see, the greater trochanter is this nub right here, part of the femur. So that's your gluteus minimus. Now your gluteus medius starts up here, attaches up above the gluteus minimus, and it comes all the way out laterally to where the iliac crust is on the posterior ilium, and it comes down over the gluteus minimus, and it comes down and it also inserts at the greater trochanter. But The gluteus medius inserts in the posterior section of the greater trochanter. Posterior greater trochanter. So as these muscles go from deep to superficial or from small to large, gluteus minimus, gluteus medius, gluteus maximus, their points of insertion go from the front to the back. So the gluteus minimus is inserted on the anterior in the front of the greater trochanter. The gluteus medius is inserted in the back of the greater trochanter. And then the gluteus maximus is inserted at the gluteal tuberosity down here, way in the posterior section of the femur. So let's look at the gluteus maximus. The gluteus maximus attaches at the iliac crest. Now notice the gluteus medius didn't attach at the iliac crest, it attached right below the iliac crest on the posterior surface, the gluteal surface. But the gluteus maximus attaches up at the top on the iliac crest, and it comes over and attaches to the sacrum, and it comes down and attaches to the coccyx. So it wraps around, goes all the way around like this. And it comes down a little bit, and then it comes down. And the gluteus maximus, although the gluteus minimus and the gluteus medius, they both wrap around the side of the pelvis, so they can get to the greater trochanter. The gluteus maximus does not wrap around. You cannot see it from the front, and you can't really see it from the side either, because it stops before it gets to the lateral section of the ilium, and it goes down to the gluteal tuberosity. It goes down to the gluteal tuberosity, and that's where it inserts. So gluteus minimus is underneath all of this, and then gluteus medius, you can kind of see up at the top little lateral corner there. It peeks out above the gluteus maximus a little bit. And then the gluteus maximus is what actually looks like your butt, is shaped like your butt. So you should have no problem picking this out on a model or a diagram, because it's the most superficial muscle. The gluteus maximus is the most superficial muscle to your butt muscle, and it's shaped like a butt, so it's just kind of obvious that that's your gluteus maximus. But then don't forget that beneath that gluteus maximus is your gluteus medius that sticks out a little bit at the top up here, and then underneath all of that, unseen, hidden by these two muscles, is your gluteus minimus.